Hello friends, in this session I'll be focusing on screening, evaluation and diagnosis of children with dyslexia. So when we are discussing on screening, evaluation and diagnosis, we should know the differences between these terms. So, and learning disability diagnosis or children with learning disability diagnosis, it's a formal assessment that determines the actual presence of a learning disability. Learning disability screening is an informal process, we can say. It's an we are saying that screening of children with learning disability, it's an informal process that shows whether there is a probability that the person might have an undiagnosed learning disability. So, when we were discussing on the signs and symptoms of children with learning disability at different levels, that time we as a teacher in a class, we can easily screen children who are having the problems with those symptoms. So, this is an informal process and known as screening. So, screening is the first step, we can say. It's the first step in child find. The school screens all children to find the ones who might need special education intervention. Screening can be any test or form, or it may be through interview to look for the disability condition or to look for the challenges present in a particular child. Based on the screening, some children will be referred for an educational evaluation or further diagnosis. So, we can say that differences between screening and diagnosis. We often misunderstood these two concepts. So, screening test and diagnosis test, I'll be discussing on it. When we are saying screening test means done to those who are apparently healthy or asymptomatic. Whereas in diagnostics test, it's done to those with suggestive sign or symptom. It has been already screened that they have some symptoms. So, much accurate testing should be done in the diagnostic test. Now, in the screening test, what happened? It applied to a group of individual. It can be applied to a group of individual. Consider our classroom. We as a teacher, we screen our children in a classroom. So, we can identify that the child may have some vision problem. We can identify child may have some learning problem. So, that way it applies to a group of individuals. Whereas, in diagnostic test, it applies to a individual, single person. Again, in screening test, results are based on one criteria, whereas in diagnostic test, results are based on the evaluation of a number of symptoms, signs and investigation. Now, we can say that screening test results are not conclusive. We cannot conclude. When we are just screening, we can see some symptoms that our child shows in the classroom. On that basis, we can't label that child as a child with dyslexia or a child with some other problem. We can't label them. So, these results are not conclusive, we can say. Whereas in diagnostic test, results are conclusive and final. In screening test, these are less accurate. Definitely, because it's only to identify the child with having some problems on the basis of their symptoms basically. So it's less accurate, whereas diagnostic test is more accurate. Even in the screening it's less expensive, whereas diagnostic test is more expensive. We have to engage professionals, like when we are seeking the IQ test, then we have to have engaged professionally qualified psychologists for the IQ test. We as a general teacher, we can't do that IQ testing. So it's more expensive rather than the screening test. So even diagnostic tests follow treatment. Once the child diagnosed as the having some problem, then we refer them for the appropriate intervention process. So these are the differences between screening and diagnosis. I hope you have understood, or you have a clear idea now what do you mean by screening test and what does it mean by diagnostic test. Now come to the signs of learning disability. So in the normal physiological development, the child is expected to acquire a certain set of basic cognition and motor skills. Any significant delay or gap in this development could be a sign of learning disability or could be sign of any other challenges. A series of well-researched and proven tests and assessment have to be conducted before diagnosing this condition. Definitely we need to have proper diagnostic test before we label a child as a dyslexic or child label as a specific learning problem. So the sign of learning disabilities may vary slightly during each stage of their childhood. Like at preschool, I'll just briefly saying all these signs. Like at preschool, child may have some of these difficulties at preschool, like developing speaking skills, communication skills at early ages when speech typically develop in children. Then pronunciation has a problem. Simple words, pronouncing simple words is a problem, may have a problem. Then recognizing letters and words, learning numbers, rhymes, songs, concentrating on tasks, following rules and direction, then using fine or gross motor skills to do physical tasks. This is also sometimes it's really amazing that sometimes we see children with dyslexia may have some gross or fine motor skill deficit also to do their physical task. Now at the primary school level, the child may have difficulty in connecting letters and sounds, differentiating between similar sounding words and rhyming words, then reading, spelling and writing accurately. That is also problem for them. In these three areas, they may face problem in reading, spelling and writing. Then distinguishing right from left, that is also a problem. So concept of right and left, they may have problem. Even sometimes if we ask them to write 25, they may write 52. They may perceive it as 25, but they write as 52. Like B and B with D that I already mentioned. So then recognizing letters of the alphabet may have a problem. Using correct mathematical symbols for doing maths problem, that is also a problem they are facing. Remembering numbers or facts is a problem again. Learning new skills. The child may be slower than other children of his age level. Then memorizing, recalling facts. I was telling that storytelling, maintaining the sequences of the story is a difficult task for the child. Then understanding body language and facial expression of others. Sometimes they face problem understanding facial expression and body language. Then showing appropriate emotional reactions in a learning environment in an aggressive or rebellious way, and react with an excess of emotion. That is also happening. Impulsivity we can see in a child in the classroom at middle school level children. Then at the high school level also we can see some of the symptoms like spelling words accurately is a difficult task for the child. They may face difficulties in reading and writing tasks. Then summarizing, paraphrasing, answering application problems and questions in test is a problem for them itself. Then poor memory. They have that kind of poor memory. They can't recall what they perceived. Then adjusting to new surroundings also. Sometimes this also become a problem for the child. Then understanding abstract concept, focusing consistently, focusing on a particular task consistently. That is also a big problem for the child with having learning difficulties. The child may lack concentration on some tasks while focusing excessively on others. Now some facts on LD, like more boys than girls are identified as learning disabled. The ratio is about 3:1. Students with learning disability are usually identified by the time they reach late 3rd or early 4th grade. More students are identified because of deficit in reading and the language arts than in mathematics. So they may have, most of the children we can find that they have difficulty in reading and language skill. IQ of identified children with learning disabilities are typically fall under 90 to 95 range. This is given by Bender in 2001. This is not, we are not saying this. These are some research facts. Like students with learning disability tend to have deficit in short-term memory. Studies that measure time on task indicate the non-disabled students are on task 60 to 80% of the time, whereas students with learning disability are on task in 30 to 60% of the time. Again, students with learning disabilities are not as socially acceptable as other students when rated by their peers and teachers. That is also found. These are some researches which shows these results. As many as 50% of students with learning disability will drop out of school prior to high school. Then psychostimulant medication seems to lengthen attention span, help control impulsivity and improve ability to stay on task and to sit quietly. Then Bryan found that in comparison to other parents, the parent of children with learning disability expect less of their children in both academic and behavioral skills. Now, some common signs which include like auditory, they have some problem in auditory, then there is a at their cognitive skill level, they may acquire new skill very slowly, may have difficulty in following direction, then especially multiple direction, they may face problems. Then they may have motor related problem, may have memory problem, like may be able to learn information presented in one way but not in another, may have difficulties in memorizing. Then organization, that is also another area where they lacks. They may have difficulties following a schedule or being on time, may have trouble learning about the time also. Then social skills also differ. Attention span, they may have short attention span, or they may be very impulsive, easily distracted sometimes. Then, as I already mentioned, that they have problems in reading skills, writing skills, math skills and language skills. So, we can say that individuals with dyslexia might be difficult to identify, since IQ test and language are not always symptomatic of the problem. Difficulty learning to read is the most reliable sign that a people may have dyslexia. Early detection of children at risk for reading difficulties can aid in assessing and treating the condition as quickly and effectively as feasible. As dyslexia is a particular learning disability defined by deficits in verbal working memory, in word reading and spelling, evaluation measures of word reading, that is actual words and pseudo words. They may have some problems in spelling also, as I already mentioned, and working memory are required for the identification of persons with dyslexia. So, now I'll say some of the most commonly used tests for dyslexia, which include comprehensive test of phonological processing, in short that is CTOPP. Then there is Delhi's Capel executive function system. Then there is Gray oral reading test. There is process assessment of the learner. There is RAN or RAS test, test of word reading efficiency, Wechsler's individual achievement test. Sometimes we use this Wechsler's test, Wechsler's fundamental test, academic skill for assessing academic skills. Then wide range achievement test 4, in short that is WRAT4 spelling subtest, that is. Then Woodcock. This I come to end of my session, and I am sure that you all will find this information useful for you all. Thank you for listening to me.